Are you having hair fall after pregnancy? Do you think after the delivery of your young one, bunches of hair are coming out in your comb, in your hairbrush, in your shower, on your drain, and you feel you're going to get bald? Are you feeling little irritated or frustrated because of this? But then baby is so much more precious. If you're having any of this video is for you, because today we will discuss why you are having this kind of a hair fall after delivery. Second, we'll discuss what is the natural course of this disease if nothing is done by you. Thirdly, we'll discuss what things you can do in order to get some or all of the hair back. What are the things which actually you can do? Then we'll discuss how you can take care of your hair, whether you keep it short, long, which shampoo you will use. And then finally, we'll discuss one of the problems which your baby can face because of this hair loss. Stay tuned with us. I'm Dr. Preeti Saraswat, American board certified hair transplant surgeon. Today we'll be discussing postpartum hair loss. Subscribe to my channel for more such information and solutions. So before discussing why this is happening with you, why so much of hair fall in the brush, in the comb, on drain, why this is happening is this postpartum hair fall is actually inevitable. It is bound to happen. There are rare cases mothers do not have hair fall. Otherwise, when I'll tell you the reasons, there are two major reasons. You yourself will understand why it is bound to happen in every female. Reason number one is during pregnancy, the estrogen and progesterone hormones which are predominant in your body, they keep the hair as such. Normally, you may have less than 100 shafts per day hair fall, but during pregnancy, you will not have this hair fall because of the effect of hormones. So they keep on having those hairs during the pregnancy time. And when these hormones are gone, post-delivery, the effect is gone, the shedding of the hair starts. So because they all were there, now the shedding is there. So the patients, when they come to us, they say, doctor, it is happening as if some hairs were glued to my scalp and now the glue is gone. It keeps on getting off full strands of hair. So what now? The second cause is delivery is a big stressful phenomena for your body. So it will release the stress hormones and thus the hair will go in telogen effluvium phase. All of this will happen in 2 to 4 months time post-delivery. In our local area, there is a saying that when the baby cools, mother loses the hair. So you see, this age-old wisdom so much coincides with the normal scientific phenomena that 2 to 4 months post-delivery, the telogen effluvium will happen and the baby will start saying mama, dada. So when the baby cools, your hair fall will happen. But the main thing is that it is not permanent. It is temporary. It's a phase of hair. So if you're liking this video till now, press the like button. Now we'll discuss if you do not do anything, what will happen now. Let us discuss now what normally happens when a hair falls off the scalp. So as you've seen, when a tooth break from the milk tooth goes away from your baby in any of the jaws, a smaller tooth is there already peeping out. So in the same way, when you lose a normal hair, a smaller hair, nascent hair already starts coming out. So this happens in your case also. Post-delivery, when you're having a normal hair fall, when the hair shaft is gone and you feel there is bunches of hair coming out, the smaller hair has already started growing. So normally, when there is no other problem, you will start regaining your lost hairs within 6 to 8 months of time. And normally when your child is 1 to 1.5 years old, you will have the normal hair back. If this is the case, there is no problem. The problem arises when you do not get your hair back. When you feel the hair has instead started thinning and you are not getting them back. Do write any of your such problem in the comment section below so that we can answer if anything like this is happening with you. So once you are having unsatisfactory hair growth, post-delivery hair fall, you must see a doctor who is fully qualified to attend you. The doctor must have good credentials, preferably American board certified hair transplant doctor or member of ISHRS like International Society of Hair Restoration Surgery and various other societies of hair. So once you go to such doctor, they will not only examine your scalp by trichoscope, but they will also get some of the investigations of your blood done. Maybe in many cases I get ultrasound also done because we have to see whether the hormones are balanced or not. Then we'll understand whether you have any nutritional deficiency like iron, calcium, B12, thyroid imbalance or any other hormonal imbalance, or you have the estrogen progesterone imbalance because of which you are losing hair. So once that is done, we give you different therapies like PRP therapy or mesotherapy, laser therapy, and then derma rollers, and then all of this together together along with minoxidil many a times will help you a lot. And then you can, once all of this is done, at least you are sure that now I can focus on other things. I can forget I'm losing such hair and my hair will be back as much as possible. If you have any other problem, you can always call us on the numbers given below so that we can help you. Now let us have a look. Let us discuss how to manage your hair when you're losing these long strands at this point of time. So one thing is the shampoo which you will use according to your scalp, and use a shampoo which gives some volume to your hair. Secondly, do not use much of a conditioner. It will make your hair flat and less voluminous, and it may increase the hair fall also. Then thirdly, you can go for different haircut for a shorter hair which will look fluffy, make the volume look larger. So during this period when you know that you will get the hair back, maybe you change the hairstyle a little bit. There is one thing which you have to be cautious of, which I'll tell you right now. Coming on to the precautions which you must take at the time of such postpartum hair loss. What happens? We are not very cautious about the long strands falling off. Baby is very small. It may happen that the hair tends to go around the finger of the child, especially the third toe or the little finger is very vulnerable. So if you see your baby crying continuously and you're not able to find out why, do check the mittens and the sock. It may happen that the hair is strangled. This comes by the name of hair tourniquet. It's not a very good name to hear about, but then yes, the hair acts as a tourniquet and it may damage the finger of your baby. So please be very careful. One thing mother can do is keep her hair tied at all the times while nursing the baby, while changing the baby, and always keep on cleaning and finding out whether any hair is there or not. This will help you, and the baby is going to be big very soon. There is no problem. Just be mindful at that time. You can always share and subscribe to this channel. Share this video with your loved ones so that they also are helped by these things. For 3 best vitamins for hair growth, click on the left video. And for scalp micropigmentation for those ladies who have too much of scalp showing, click on the right video.